Have you ever found yourself puzzling over a horse that's constantly stomping its feet? Or maybe you spotted some, stubbornly crusty, greasy patches on their lower legs?
Especially after a stretch of wet weather.
Exactly. Maybe you've heard terms like scratches or mud fever, maybe greasy heel whispered around the barn.
That's common names, yeah.
Well, today we're embarking on a deep dive into something, well, far more complex than those casual names might suggest. We're unmasking equine Pastern dermatitis, or EPD. And what's truly key to understanding EPD right from the start is that it's not actually a single disease. Not at all.
That's the crucial point, isn't it?
It's a syndrome, a collection of signs, or what veterinarians call a cutaneous reaction pattern.
Right, a pattern of how the skin reacts.
At its core, EPD is about inflammation, irritation, and skin damage on the lower limbs, specifically around the pastern and heel area. Okay, so let's unpack this a bit. Our mission today is really to cut through the confusion surrounding EPD. We'll explore its surprising array of underlying causes, understand what clues to look for,
What you should be seeing, yeah.
and then most importantly, dive into how it's meticulously diagnosed and effectively treated.
And what's fascinating here, I think, is just how many different factors can actually contribute to EPD.
Right.
Understanding it means looking beyond just the surface symptoms. You have to grasp the underlying picture. It's rarely simple. Often it's a symptom of something, well, something deeper. Requires a bit of detective work.
That's a really vital distinction. And when we talk about that underlying picture, the common thread across pretty much all forms of EPD is damage to the skin's natural barrier.
The shield, basically.
Yeah, think of the skin as that protective shield.
Yeah.
When that shield gets compromised, it kind of rolls out the welcome mat for all sorts of irritants or pathogens to sneak in.
Precisely. And this barrier breakdown often begins with certain predisposing factors, things that set the stage.
Yeah.
The most significant one, without a doubt, is chronic moisture. Prolonged exposure to wet, muddy, or even just unsanitary conditions. It really softens and weakens that protective skin layer.
Ah, okay. That's why we get those descriptive names like mud fever or dew poisoning.
Exactly. The consistent dampness literally creates a perfect storm for problems to start brewing.
So it's not just the mud itself, but the duration of the wetness. And I imagine poor hygiene, like dirty bedding or manure buildup, also plays a big role, sets the stage.
It absolutely does. Huge role. It really brings home how much the environment can either help or, well, hinder healing, doesn't it?
Definitely.
And even seemingly minor things like abrasive footing, rough surfaces, they can cause micro trauma to the skin, creating that initial opening for more serious issues to grab hold.
Okay. Now, once that skin's natural shield is compromised, what specific troublemakers actually seize the opportunity? What causes the dermatitis itself?
Right, the inciting factors.
That's where our list comes in, and it's quite a varied bunch.
Indeed it is. Bacterial infections are very, very common, either as the primary problem or often as a secondary complication once the skin's already damaged.
Like an opportunist.
Exactly. Dermatophilus congolensis, you might know it from causing rain rot, is a frequent culprit. It leads to those characteristic crusts and matted hair you mentioned earlier.
Okay.
But we also very frequently see Staphylococcus and Pseudomonas species. These are those opportunistic bacteria that just love to crash the party once the skin barrier is down.
Yeah.
And they can make things much, much worse.
And what about fungal infections? I've heard about ringworms sometimes in horses.
Yeah, fungi can certainly cause similar crusting lesions, dermatophytosis or ringworm, though honestly, they're probably less common than bacterial infections in this specific area, the pasterns.
Okay.
But then there are mites, particularly Coreoptes equi. These are a huge factor, especially in breeds with heavy feathering.
Like the Drass breeds.
Exactly. Clydesdales, Shires, Belgians, even fjord horses.
You mentioned that feathering is a huge factor for mites. How do those, beautiful long hairs actually contribute to the problem?
Well, they create the ideal microclimate for the mites. It's perfect for them. Those long hairs trap moisture and dirt, creating this warm, moist, sheltered environment where the mites just thrive.
Okay, so it's like a little humid house for them.
Pretty much. And these mites cause intense itching pruritus. So the horses stomp, they rub, they might even chew at their legs.
Which just makes the skin worse.
Exactly. It only exacerbates the dermatitis. And what's also really crucial to remember here is that Cordytoptes mites can survive off the horse for up to 70 days.
70 days, wow. In the environment.
In the environment, yeah. So that's your critical insight right there.
Ah.
If you don't do a thorough barn clean and environmental decontamination, you're essentially just reinfecting your horse, no matter how good your topical treatment is.
Yeah, it's huge. You have to treat the environment too.
Absolutely. And less commonly, you might see parasitic larvae involved as well.
Now, this next cause you mentioned is, well, it's quite surprising to me. Photosensitization. How does light get involved with a leg condition?
Yeah, it's a distinct and important cause, and it's truly fascinating how it works. This happens when a horse ingests specific plants that are phototoxic.
Like what kind of plants?
Think St. John's wort, Elsic clover, buckwheat, certain perennial ryegrasses, or alternatively, it can happen if the horse has significant liver damage.
Liver damage. How does that connect?
Well, liver damage can lead to a buildup of a compound called phytoerythrin in the blood. In both scenarios, the plants or the liver issue make the horse's unpigmented skin hypersensitive to UV light.
So it's like a really severe sunburn, but it's triggered from the inside.
That's a good way to put it, yeah.
And it only affects the white areas, like white socks or blazes.
Exactly. You'll see a severe sunburn-like reaction, often exclusively on those white unpigmented areas of the legs, and sometimes the muzzle too.
Yeah.
The skin gets intensely red, swollen, painful. It can even slough off. And we classify it as either primary, so directly from eating the plants, or secondary hepatogenous, meaning it's linked to underlying liver disease. That liver connection is a really critical diagnostic clue for vets.
Right. Okay. And allergies. Can horses actually get allergic reactions down on their pasterns?
Absolutely. Allergic contact dermatitis is a definite possibility. That's where the horse reacts to something topical that touches the skin.
Like what? Liniments? Shampoos?
Could be harsh liniments, certain ointments, detergents used on wraps, even bedding material sometimes. And while it's maybe less common on the legs than other body parts, insect bites can also trigger localized allergic reactions down there.
Okay. Moving into even more complex territory now, immune-mediated conditions. These sound pretty serious.
Yes, and they can be quite serious. Pastern leukocytoclastic vasculitis, or PLV, for example, that's one of the more severe immune-mediated forms.
What is that exactly?
It's basically an inflammation of the small blood vessels in the skin. It seems to often be triggered by sun exposure on those unpigmented areas.
Again with the white legs.
Often, yeah. And it's particularly common in those feathered draft breeds again. It can lead to significant skin damage, even sloughing. Needs very specific veterinary care.
Okay.
And then there's pemphigus foliaceus. It's another autoimmune disease. It causes blistering of the skin. It's rare, but it can affect the pasterns too.
So the horse's own immune system is kind of inadvertently attacking its skin?
In simple terms, yes. That's the idea.
Are there any other sort of general factors that might predispose a horse to EPD?
Well, conformation definitely plays a role. Horses with heavy feathering, like we discussed, they're predisposed because that long hair traps moisture and dirt. Simple as that.
Right.
Skin folds in the pastern area can also trap secretions, creating a moist, less ventilated environment. And of course, any minor trauma.
Like scrapes or cuts?
Yeah. Or even just vigorous scrubbing when you're cleaning them. That can damage that fragile skin barrier. And then, rarely, you might have an underlying systemic disease that affects the horse's overall immune function or circulation, making them more susceptible to EPD.
So, okay, you've spotted those telltale signs, the crusts, the swelling, maybe even those notorious grapes you mentioned. The next critical step for any horse owner is, how do we pinpoint the exact cause? What should you be looking for, and what are the key signs that tell you something's really wrong?
Well, the first thing to remember is that the signs are highly variable. They really depend entirely on the underlying cause and, how severe the condition actually is.
Makes sense.
But there are common themes. You'll almost always see some redness, erythema, and some hair loss, alopecia, often in patches.
And those crusts, that's what most people think of with scratches, right?
Yes. Thick, often painful crusts or scabs are very characteristic. They look greasy, sometimes flaky, sometimes dry. And the hair often gets matted with exudate, that serum or pus oozing out. That's where the name greasy heel comes from.
Oh, okay.
You might also just see oozing without thick crusts. Swelling or edema around the lower limb, especially the pastern and fetlock, is also common.
And worst cases.
In more severe cases, you'll find open sores, ulceration, and painful fissures or cracks, especially right there at the heel bulbs. Those can be really sore.
Ouch. Now, I've heard chronic cases can lead to something called grapes. It's a memorable image, but sounds bad. What exactly are those?
Ah, yes, grapes. They are memorable and definitely concerning. In severe chronic cases, particularly in draft breeds again, you can get what's called exuberant granulation tissue.
Granulation tissue, like proud flesh.
Kind of, but on a massive scale here. These are large, wart-like, really firm, cauliflower-like masses that form on the skin. They're often very, very resistant to treatment and signal a long-standing deep issue.
Wow.
And the skin itself in chronic cases can also become thickened and leathery. We call that lichenification or develop excessive scaling and roughness, which is hyperkeratosis, just generally unhealthy thickened skin.
Okay. Beyond just the visual changes to the skin, are there other important clues? Things you might notice about the horse's behavior?
Definitely. Pain is almost always present, especially when those scabs are handled or removed. You have to be gentle.
Right.
Lameness can range from just mild stiffness to quite significant lameness, particularly if there's a deep secondary infection brewing under the surface.
Makes sense.
And if mites or allergies are involved, you'll often see a lot of itching pruritus. The horse might stomp constantly, rub its legs on things, or even try to chew at them.
Okay, that's a big clue.
It is. And with those secondary bacterial infections we talked about, a foul odor is unfortunately pretty common.
Okay. And who is most affected? Is it really just the draft horses, or can any horse get this?
Well, while EPD certainly can occur in all breeds, it is definitely most common in the heavy draft horses. We often see it starting around a mean age of 9 years or so.
Interesting.
And frequently we see it affecting both hind limbs, sort of symmetrically. But really, it can appear on any leg, front or back.
Okay, so we've talked about what it is, what it looks like. This sounds like quite the puzzle to figure out. Now, for the real detective work, how do vets actually diagnose EPD, given all these potential causes? Because getting that diagnosis right sounds absolutely crucial for treatment. You can't treat what you don't know, right?
That's the absolute core insight. Diagnosis is paramount. And the process really begins with a detailed history. Your veterinarian will ask a lot of questions.
Like what sort of things?
About the onset, when did it start? How long has it been going on? Is there any seasonality? Like, is it worse in wet weather or maybe worse in the summer, which might suggest allergies or photosensitization?
Okay.
They'll also ask about the housing conditions, any recent changes in feed or bedding, any new products being used on the legs, and definitely if there's any itchiness or lameness involved.
Is the breed matter?
Yes, the horse's breed and coat color are also important clues. Especially if they're white markings or heavy feathering, that points us towards specific possibilities like photosensitization or those Coreoptes mites.
And then, after the history, a good, thorough look at the horse, I imagine.
Exactly, a thorough clinical examination. That involves carefully inspecting and feeling all 4 lower limbs, noting the exact location, the distribution, and the characteristics of those lesions. Are they crusty, oozy, thickened?
Right.
And if photosensitization is on the suspect list, they'll also specifically check other unpigmented areas like the muzzle for similar signs.
Gotcha. What about diagnostic tests? Is it a lot of guesswork, or are there specific tools vets use?
Oh, there are definitely tools. It's guided by suspicion based on the history and exam. One very common first step is carefully clipping the hair from the affected areas.
To get a better look.
Exactly. It allows for much better visualization of the skin itself, and just as importantly, it helps any topical treatments you apply actually reach the lesions effectively.
Makes sense. But I imagine that could hurt.
It can. It's crucial to do the clipping very gently because the skin is already inflamed and painful. Sometimes sedation might be needed to do it properly without causing more stress or trauma.
Okay, so gentle clipping first. What next?
After clipping, skin scrapes are really essential, especially if you suspect mites like Coreoptes equi. You scrape the skin surface and look at it under a microscope.
Right. Looking for the little critters.
Exactly. Then there's cytology, or impression smears. That's where you take a sample directly from the exudate or the underside of a crust, put it on a slide.
And look under the microscope again.
Yep. That can quickly help identify bacteria, like the characteristic chains of Dermatophilus congolensis, or inflammatory cells, which helps guide the initial treatment choices.
What if it's a really persistent infection?
For those persistent infections, bacterial and fungal cultures are the way to go. You send a sample to the lab, they grow whatever's there, identify it specifically, and then test which medications will actually kill it. That's the sensitivity testing part, really important for stubborn cases.
And when do biopsies come into play? That sounds like a more serious, definitive step.
Biopsies are crucial for several situations. Chronic cases that aren't responding to standard treatment, lesions that look really unusual or atypical.
Like those grapes.
Exactly, especially if those grapes, the exuberant granulation tissue, are present. Or if the vet strongly suspects an immune-mediated disease like vasculitis or pemphigus, or even rarely, skin cancer, neoplasia.
So the biopsy gives a definite answer for those.
Often, yes. The
Oh.
pathologist looks at the skin structure under the microscope, and that's often definitive for confirming those more complex conditions like vasculitis or pemphigus.
Anything else? Blood work.
Sometimes, blood work, specifically checking liver enzymes, might be done if that hepatogenous or liver-related photosensitization is suspected. And allergy testing, either skin tests or blood tests, can be performed if allergic dermatitis seems likely based on the history. It's really about building a complete picture from all the clues.
Okay, so we've unraveled the mystery of what EPD is, this complex syndrome, and how this meticulous diagnostic work helps pinpoint the specific cause. Now, for the treatment, which sounds like it demands a lot of, well, patience and persistence from everyone involved.
It absolutely does. That's probably the key message for owners. Treatment is almost always a multimodal approach.
Meaning you have to do several things at once.
Exactly. You have to address the specific underlying cause you diagnosed, provide really careful local wound care, and offer supportive measures. And yes, patience and consistency are paramount for success and, importantly, for the horse's comfort through the process.
So what's the first most crucial step once you have a diagnosis or even while you're waiting for test results?
Environmental management. Without a doubt. Immediately move the horse to a clean, dry environment.
Get them out of the mud.
Get them out of the mud, out of the wet pasture. This might mean stalling them during wet weather or making sure turnout areas are dry and well drained. Even avoiding turnout until the morning dew has dried off the grass can be really key. That lingering moisture just perpetuates the problem.
And keeping the stall clean.
Non-negotiable. Keep stalls meticulously clean and dry. Change bedding frequently.
And what about those feathers and the matted hair we talked about? They seem like they'd get in the way of treatment.
They do. You need to carefully clip the hair, especially those heavy feathers if they're present, from all the affected areas.
Why is that so important?
It allows for vital air circulation to the skin, which helps it dry out, and it ensures that any topical medications you apply can actually reach the skin surface and do their job. But again, remember this can be painful.
Right. Sedation might be needed again.
Might be, yes, to do it thoroughly and without causing more trauma or stress to the horse.
Okay, so the area is clean, dry, and clipped. How do you actually deal with those crusts and scabs? You said before you should not just rip them off.
Absolutely not. That's critical. The key is gentle soaking first. You want to soften the scabs.
How do you do that?
With warm water, maybe using a mild antibacterial or antifungal shampoo, things containing chlorhexidine, povidone iodine, benzoyl peroxide, or miconazole are often used. Or you can use softening agents like plain mineral oil or a zinc oxide paste applied generously and left on for a while.
Let it soak in and soften things up?
Exactly. The crucial instruction here is do not pick or forcibly pull the scabs. It's incredibly painful. It causes bleeding, damages the delicate healing skin underneath.
Sets you back.
Sets you right back. Makes it more prone to further infection and definitely delays recovery. If removal is really difficult, even after soaking, sedation might be needed to allow for gentle, careful debridement.
Okay, so gentle soaking, gentle removal if needed, and then what?
Thorough drying is next. Pat the area completely dry after washing. Don't rub aggressively. Air drying is ideal if the horse is in a clean, dry environment. Avoid leaving the legs wet at all costs.
Right. Moisture is the enemy here.
Pretty much. Once cleaned and thoroughly dried, you can apply your prescribed topical medications.
What kind of medications?
It depends on the diagnosis, of course. But they might include topical antibiotics like mupirocin or silver sulfadiazine for bacterial infections, maybe antifungals like miconazole or ketoconazole if fungus is involved. Sometimes mild topical steroids like hydrocortisone or betamethasone are used short-term to reduce inflammation and itching.
Steroids need caution, though.
Yes, especially long-term use. You need to be careful with steroids as they can thin the skin or have other side effects. Always follow your vet's instructions.
Okay, and what about once it's clean and treated? How do you protect the healing skin from getting red or irritated again?
That's where barrier creams come in. They're really useful. Once the lesions are cleaned and drying, applying a protective water-resistant cream like zinc oxide paste, the thick white stuff, or even just petroleum jelly can be very helpful.
Creates a shield.
Exactly. Creates a physical shield, protecting that healing skin from moisture and environmental irritants. For very oozy lesions, sometimes astringents like dilute aluminum acetate solution or lime sulfur dips might be recommended to help dry them out initially.
What if the case is really severe? Or just not responding well to all the clipping and cleaning and creams? Is there a next level of intervention?
Yes, absolutely. If it's severe or refractory, then systemic medications given by mouth or injection become necessary.
Like antibiotics.
Oral or injectable antibiotics are definitely indicated for severe bacterial infections, especially if there's cellulitis.
What's cellulitis again?
That's a deeper infection, spreading under the skin, causing significant swelling and heat, or if the horse has a fever, that signals a systemic infection.
Okay. What else besides antibiotics?
For mite infestations, those coreoptes, systemic antiparasitics like ivermectin or doramectin, are usually needed. Sometimes topical epinephrine solutions work too. But you often need repeat doses.
Because of the mite life cycle.
Exactly. You need to kill the hatching eggs too. And as we stressed before, environmental decontamination is vital when dealing with mites. Can't forget that.
Right.
Then oral corticosteroids might be used for those severe immune-mediated conditions like vasculitis or pemphigus, or for really severe allergic reactions that aren't controlled otherwise. And of course, NSI's non-steroidal anti-inflammatories like phenylbutazone or flunixin can help manage pain and lameness.
And for those photosensitized horses we talked about, the ones reacting to sunlight.
Keeping them out of direct sunlight is obviously crucial. Stalling during the day, turn out at night, or using UV protective wraps or bandages to physically cover the affected white areas.
And addressing the underlying cause.
Absolutely. If it's secondary photosensitization, any underlying liver disease needs to be diagnosed and managed as best as possible. That's the root of that particular problem.
Finally, let's talk about bandaging. Is that always a good idea for EPD, or are there caveats? Seems like it could protect the leg.
It can, yes. Bandaging definitely can protect lesions from dirt and trauma, help keep medications in place against the skin, and sometimes help reduce swelling. However,
There's a but.
there's a big but.
Yeah.
There's a critical warning here. Bandages must be kept clean, kept dry, and changed daily, sometimes even more often if there's a lot of ooze.
Why is that so important?
Because improper bandaging or leaving wet or soiled bandages on can actually exacerbate the EPD significantly. It traps moisture right against the skin.
Creates that perfect storm again.
Exactly. Traps moisture, promotes bacterial growth, reduces air circulation. You should generally avoid fully waterproof bandages for this reason. In many cases, once the really acute exudative oozy phase is managed, allowing air circulation is often preferred over bandaging. It's a tool, but one that requires very careful management.
Okay, that's really important to know. So what does this all mean for you, the horse owner listening? What's the typical prognosis for a horse with EPD? And maybe more importantly, how do we prevent this complex syndrome from coming back again and again?
Well, the prognosis for equine pastern dermatitis is, as you might guess by now, highly variable. It really truly depends on identifying and successfully addressing the specific underlying cause.
The detective work.
The detective work, yes. It also depends on the severity and the chronicity, how long it's been going on, and, crucially, on the owner's commitment to consistent, often long-term management.
So it's maybe good for mild, straightforward cases, but more guarded for the really serious or stubborn ones?
Precisely. Mild cases that are clearly due to environmental factors like just too much mud or common bacterial infections. If they're treated promptly and appropriately, they often have a good prognosis. Full recovery is likely. But chronic recurrent cases, those severe immune-mediated forms like the vasculitis leading to those grapes, or cases complicated by deep infections or significant scarring, those often require ongoing lifelong management. They might never fully resolve, becoming more of a continuous challenge to control rather than cure. The prognosis there is much more guarded.
And I imagine recurrence is pretty common if those initial predisposing factors, the wet environment, the feathers, the allergies aren't really managed properly. Sounds like you could just be playing whack-a-mole if you don't address the core issue.
That's an excellent analogy, and it's a key takeaway for listeners. If those underlying predisposing factors aren't adequately managed, recurrence is highly, highly likely. You might clear up the current flare-up, but if the foundation for the problem is still there, it'll probably come back.
So prevention really sounds like it's all about diligently avoiding or managing those predisposing factors in the first place, or after you've treated an episode.
Exactly right. Prevention focuses on environmental control and good management practices. Avoid turning horses out in persistently wet, muddy fields, especially maybe avoiding that early morning turnout when the dew is heavy.
Stall hygiene again?
Stall hygiene, absolutely critical. Keep stalls scrupulously clean and dry. For susceptible horses, sometimes applying a light barrier cream before exercise or turnout, especially in damp conditions, can help.
Proactive protection.
Yes. And then consistently cleansing and, importantly, Thoroughly drying the legs after work or after they've been exposed to moisture can significantly help prevent recurrence. And one other point, it's important to identify and treat any asymptomatic carriers, say of ringworm or mites, in a herd, so they don't continuously spread the issue to other susceptible horses.
Right, that makes sense. So, recapping this, what does this all mean for you listening? We've really seen that equine Pastern dermatitis isn't just simple scratches. It's a complex syndrome.
Definitely complex.
And it demands a thorough investigation, like detective work, to find that root cause for any chance of truly effective, long-lasting treatment. It really highlights the importance of working closely with your vet, like a detective team.
Absolutely. And if we connect this to the bigger picture, EPD truly highlights the interconnectedness of a horse's health. Everything from their environment, their genetics, their conformation, their immune system, it all plays a part. It really raises an important question, I think, about the level of vigilance and sort of holistic care that's required for optimal equine well-being.
Yeah.
It pushes us to look beyond just the obvious symptom.
That's a great point. You know, this deep dive into EPD isn't just about horses' legs. It feels like a powerful reminder that sometimes the most common everyday ailments are actually these sophisticated puzzles. They demand a detective's eye and, as you said, a really patient hand. It really makes you think, doesn't it? How many simple problems we encounter, maybe in all aspects of life, are actually complex syndromes in disguise, just waiting for us to look a little deeper.